So, part B. When we look at the B section of the chart, we are focusing primarily on the main types of naturally occurring human estrogen. We're talking about naturally occurring human estrogen because this is what the body produces. We are actually speaking, when we talk about estrogen, of a family of 20 or so related hormones. These hormones include estradiol, which is E2, Estrone, which is E1, and Estriol, which is E3. Also 16-alpha hydroxyestrone, 2-hydroxyestrone, 4-hydroxyestrone, 2-methoxyestrone, and 4-methoxyestrone. Now, those are a lot of different estrogens that we're talking about. Usually, someone just uses the word estrogen, but they're actually a family of 20 or more. And each of these we'll talk about in a little more detail. I don't want your head to swim or anything because of this, but each of these is different because some of them are more healthy and some of them are more toxic and cancer-producing when they are in the body. So eliminating the cancer-producing ones is a key component of nutritional management of good estrogen metabolism. So estradiol, which is E2, is the most physiologically active estrogen in a non-pregnant woman. Its potency is actually 12 times that of estrone, which is E1, and 80 times that of estriol, which is E3. So estradiol is the most physiologically active. Now, according to one source, the typical ratio in the bloodstream of women is 10% estradiol, 10% estrone, and 80% estriol. Estriol, again, 3, is the weakest estrogen. It's the most short-acting, and it acts as a buffer by stimulating and suppressing the receptor sites, which are the little places on the cell membrane that cause a reaction and a response of the cell to the hormones. Now, in non-pregnant women, estrogens are mostly produced in the ovaries and the adrenal cortex, in the adrenal gland. In pregnant women, estrogens are also produced in the placenta. Estriol, that's E3 levels, are monitored as an indication of fetal health when the mother's condition is stressed, as estriol is produced by the placenta. So those are all the different types of estrogen. And let's take a look at this chart here. So here we have the chart. We have estrogen E2, which is estradiol. We've got estrone here. Then over here, we have these other forms of estrogen. We have the 16-alpha hydroxyestrone we talked about. We talked about estrogen E3, estriol. We have 2-hydroxyestrone. We have the 2-methoxyestrone derivative, 4-hydroxyestrone, and the 4-methoxyestrone here. These are all the different kinds of estrogen that we are focusing on in our discussion here of the nutritional supplementation in order to improve the way a woman's body metabolizes or deals with estrogen. Now, if women had all the estrogen that they ever produce in their life still in their bodies, there would be a lot of extra mood alteration. There would be a lot of other chaos going on, actually. If you have too many hormones in your body, you are going to have a lot of chaos. So, I mean, think about it. If men had all the testosterone that they produced since they were young, they would be totally off the wall. So our body and a woman's body, because there is this cycling of estrogen that has to occur for the menstrual cycle to work. Estrogen increases in the first part of the cycle. Then once it gets to a certain point, it starts to cause the increase of progesterone for the second half of the menstrual cycle. So estrogen has to get high enough, but it also has to drop down. Now that estrogen produced by the body has to be removed by the body, and that is removed in these different fashions over here. It's removed by the breakdown and the conversion of these estrogen into forms that can be eliminated through the stool and through the urine. So we don't keep all the estrogen in our body that's produced every month because it has to go down. It has to actually drop for a menstrual cycle to occur again. So that's why I talk about all these different estrogens. And it's very important to know that this has to be taken out of the body at the end of the cycle. There will be baseline amounts of estrogen, but the excess amount has to be removed, or you actually may have difficulties having the regular menstrual cycle. And this is one of the things that we monitor with respect to infertility. Okay, let's go on to section 3.